When you look at your blood pressure monitor, you probably think you are seeing 3 numbers. But what if I told you there is actually another number hidden inside those readings? Your monitor doesn't display this number directly, but you can calculate it yourself in just a few seconds, and it can give you another way to understand what may be happening inside your arteries. So if you have a recent blood pressure reading nearby, keep it ready. Because in the next few minutes, I'm going to show you how to find this hidden number and what it may tell you about your blood pressure. Let's make it simple. Take your top blood pressure number and subtract your bottom number. For example, if your reading is 140/80, subtract 80 from 140. That gives you 60. This number is called pulse pressure. But don't worry if you've never heard that term before. The number itself doesn't tell you everything. Its real meaning becomes clearer when you understand what your arteries are doing with every heartbeat. You've probably heard arteries described as pipes, and technically, they do carry blood from your heart to the rest of your body. But healthy arteries are much more flexible and active than ordinary pipes. Every time your heart beats, it pushes a wave of blood into your arteries. Healthy arteries can expand slightly when that wave arrives. This flexibility helps absorb some of the force created by the heartbeat. Then, when the heart relaxes between beats, the arteries gently move back toward their normal shape. That helps keep blood moving even while your heart is resting between beats. Think of your arteries almost like flexible elastic tubing. They expand when pressure arrives and then gently recoil. This helps smooth out the pressure created by each heartbeat. As we get older, however, our arteries can gradually become less flexible. This doesn't usually happen suddenly. Instead, it can develop slowly over many years. When arteries become stiffer, they may not absorb the pressure wave as effectively. The top blood pressure number can rise, while the bottom number may not rise in the same way. As a result, the difference between the two numbers can become larger, and that's where pulse pressure becomes interesting. Pulse pressure is simply the difference between your systolic and diastolic blood pressure. The top number is systolic pressure. The bottom number is diastolic pressure. So if your blood pressure is 148, your pulse pressure is 140 minus 80 equals 60. A wider pulse pressure can sometimes be associated with greater arterial stiffness, particularly in older adults. Researchers have studied pulse pressure because higher values have been associated with an increased risk of cardiovascular problems in certain groups. But there's an important warning here. Pulse pressure is not a diagnosis, and it should never be looked at by itself. Think about 2 people. Imagine both are 72 years old. Person A has a blood pressure of 140/80ths. Person B has a blood pressure of 180/120ths. Both have a pulse pressure of 60, but their overall blood pressure is obviously very different. The second person has a much higher blood pressure and needs to take that seriously. This shows why pulse pressure cannot replace the actual blood pressure reading. It is simply another piece of information. There isn't one perfect pulse pressure number that applies to everyone. A pulse pressure around 40 millimeters of mercury is often seen in younger, healthy adults. As people age, pulse pressure commonly becomes wider. That can happen partly because arteries naturally become less elastic over time. A persistently wider pulse pressure, especially when it occurs alongside high or rising blood pressure, is something worth discussing with a healthcare professional. But don't look at one isolated reading and immediately assume something is wrong. Blood pressure can change throughout the day because of stress, activity, caffeine, medications, illness, and even how you position your body during the measurement. That's why patterns are usually more useful than one single number. This is probably the most important idea to remember. Don't think of your blood pressure as simply 2 numbers on a screen. Those 2 numbers are telling you different parts of the same story. The top number tells you the pressure in your arteries when your heart is contracting. The bottom number tells you the pressure when your heart is relaxing between beats. And the difference between them gives you your pulse pressure. So one blood pressure reading can give you several pieces of information, but none of these numbers should be interpreted completely on their own. If you've just calculated your pulse pressure and the number looks higher than you expected, don't panic. A wider pulse pressure does not automatically mean you're about to have a heart attack. It doesn't prove that you've had a stroke, and it doesn't diagnose arterial disease by itself. Instead, think of it as a reason to pay closer attention to the bigger picture. Look at your systolic pressure. Look at your diastolic pressure. Look at your readings over time. Consider your age, medications, lifestyle, and other health factors. And if you consistently notice unusually high blood pressure or a wide pulse pressure, discuss those readings with your doctor. The goal isn't to become frightened by another number. The goal is to understand your body better. So the next time you check your blood pressure, don't just look at the number your monitor displays. Take a few seconds and calculate the difference between the top and bottom numbers. That hidden number is your pulse pressure. It doesn't tell the whole story, but it can give you another useful piece of information about what's happening with your cardiovascular system. And once you understand the top number, the bottom number, and the difference between them, your blood pressure reading starts to make much more sense. In my next video, we'll take a closer look at the bottom blood pressure number, diastolic pressure, and what it may actually be telling you about your heart and arteries. Thanks for watching, and I'll see you in the next video.